Question 1. System analysis indicates a high volume of incoming calls during a shift. The first call reports a potential burglary in progress at a residential address. Immediately following, a call reports a loud argument with sounds of physical struggle at a nearby residence, indicative of a domestic dispute. Concurrently, a third call reports a multi-vehicle traffic accident with injuries on a major roadway. As an emergency telecommunicator, which incident requires the absolute highest priority for immediate dispatch of law enforcement resources, assuming all calls are received within seconds of each other and standard response protocols are in effect. Option A, the domestic dispute. Option B, the burglary in progress. Option C, all incidents require equal and simultaneous dispatch consideration. Option D, the multi-vehicle traffic accident. Correct answer is B, the burglary in progress. Explanation. This scenario presents a common challenge for emergency telecommunicators, etc., in prioritizing incoming calls based on the nature of the incident, which directly impacts resource allocation and public safety. The core difficulty lies in accurately assessing the severity and immediate threat posed by each reported incident, especially when information is fragmented or potentially exaggerated by the caller. The etc. must balance the urgency of a crime in progress against the potential for escalation in a domestic dispute and the immediate need for assistance in a traffic accident, all while adhering to established protocols and legal mandates for response. The correct approach prioritizes the crime in progress due to the immediate and active threat to life and property. This aligns with the fundamental duty of law enforcement and emergency services to intervene in situations where criminal acts are currently occurring and pose a direct danger. Regulatory frameworks for etc. certification emphasize the importance of rapid threat assessment and appropriate dispatch of resources to mitigate harm. This approach reflects best professional practice by directly addressing the most volatile and potentially life-threatening situation first, thereby minimizing the risk of further harm or escape by perpetrators. An incorrect approach that prioritizes the domestic dispute over the crime in progress fails to adequately recognize the immediate danger presented by an active criminal event. While domestic disputes are serious and often require urgent attention, a crime in progress typically signifies a more immediate and overt threat that demands immediate intervention to prevent further harm or loss. Ethically and regulatorily, delaying response to an active crime for a situation that, while serious, may not be as immediately volatile, constitutes a failure in prioritizing public safety. Another incorrect approach that prioritizes the traffic accident over the crime in progress demonstrates a misunderstanding of incident severity. Traffic accidents, while requiring prompt medical and potentially law enforcement attention, do not inherently carry the same level of immediate threat to life and limb as a crime in progress. Regulatory guidelines for etc. stress the need to differentiate between incidents based on the potential for immediate harm. Failing to do so can lead to misallocation of critical resources and potentially tragic outcomes. Finally, an approach that attempts to handle all calls simultaneously without clear prioritization is a fundamental failure in operational procedure and regulatory compliance. Etc. are trained to manage multiple incoming calls and incidents through established protocols that include prioritization matrices. Attempting to address all situations equally without regard for their inherent urgency and threat level is inefficient, unsafe, and directly contravenes the principles of effective emergency response mandated by etc. certification standards. The professional decision-making process for similar situations involves a systematic evaluation of incoming information against established incident classification and prioritization protocols. Etc. must actively listen, gather critical details, and assess the level of immediate danger, potential for escalation, and required response type. This assessment should then be mapped against agency protocols and legal requirements to determine the appropriate dispatch order and resource allocation. Continuous training and adherence to these established frameworks are crucial for ensuring optimal public safety outcomes. Question 2. Investigation of a 911 call reporting a sharp, stabbing pain in the upper right side of my abdomen, near my ribs, and it's making it hard to breathe deeply, requires the emergency telecommunicator to perform a risk assessment. Which of the following approaches best guides the etc. immediate actions and subsequent questioning? Option A. Instruct the caller to try and pinpoint the pain themselves and describe it in their own words, without offering specific medical terminology prompts. Option B. Ask the caller to describe the exact location of the pain using anatomical landmarks and inquire about any associated symptoms such as nausea, fever, or changes in bowel habits. Option C. Reassure the caller that the pain is likely muscular and advise them to rest and take over-the-counter pain relievers. Option D. Focus primarily on the caller's breathing difficulties and ask if they have a history of lung conditions, disregarding the specific location of the pain. The correct answer is B. Ask the caller to describe the exact location of the pain using anatomical landmarks and inquire about any associated symptoms such as nausea, fever, or changes in bowel habits. Explanation: this scenario is professionally challenging because the emergency telecommunicator, etc., must quickly assess the severity of a medical complaint based on limited, potentially imprecise information provided by a distressed caller. The etc. ability to accurately interpret and prioritize the caller's description of symptoms is critical for dispatching appropriate resources and providing effective pre-arrival instructions. The risk assessment involves understanding the potential implications of anatomical descriptions and medical terms, even if not perfectly articulated. The correct approach represents best professional practice because it prioritizes gathering specific, actionable information about the patient's condition and location. This aligns with the fundamental duty of an etc. to ensure public safety by facilitating timely and appropriate emergency response. By focusing on the caller's description of pain location and associated symptoms, the etc. can begin to form a preliminary risk assessment, guiding subsequent questions and resource allocation. This methodical approach ensures that vital details are not overlooked and that the emergency services are dispatched with the most relevant information. An incorrect approach that focuses solely on the caller's emotional state without probing for medical details fails to meet the core responsibility of an etc. This represents a regulatory failure to adhere to protocols that mandate the collection of essential patient information for effective emergency response. Similarly, an approach that dismisses the caller's description as just pain without further investigation is a critical ethical failure. It demonstrates a lack of diligence and a disregard for the potential seriousness of the caller's complaint, which could lead to delayed or inappropriate medical intervention, violating the ethical obligation to provide competent and compassionate service. An approach that relies on the caller's self-diagnosis without verification is also problematic, as laypersons may not accurately identify their condition, leading to misallocation of resources. The professional decision-making process for similar situations should involve a structured approach. 1. Establish rapport and ensure the caller's safety. 2. Actively listen and gather critical information, including location and nature of the emergency. 3. Utilize a systematic questioning process to elicit details about symptoms, pain, and associated signs, paying close attention to anatomical references and any medical terms used. 4. Perform a preliminary risk assessment based on the gathered information to determine the urgency and type of response needed. 5. Provide clear, concise pre-arrival instructions. 6. Maintain calm and professional demeanor throughout the interaction. Question 3. What factors determine the optimal balance between using plain language and the phonetic alphabet for critical identifiers in emergency radio communication to ensure maximum clarity and efficiency? Option A. The availability of advanced encryption for radio transmissions. Option B. The personal preference of the responding units for either plain language or phonetic spelling. Option C. The time of day and the perceived workload of other telecommunicators. Option D. The potential for signal interference, the complexity of alphanumeric identifiers, and the urgency of the situation. The correct answer is D. The potential for signal interference, the complexity of alphanumeric identifiers, and the urgency of the situation. Explanation: this scenario is professionally challenging because the emergency telecommunicator, etc., must ensure clear, unambiguous communication during a potentially life-threatening situation. Misinterpretation of radio traffic can lead to delayed response, incorrect resource deployment, or even endangerment of responders and the public. The etc. judgment in selecting the appropriate communication protocol is paramount. The correct approach, utilizing plain language when possible and supplementing with the phonetic alphabet for critical identifiers, represents best professional practice because it balances efficiency with accuracy. Plain language is generally faster and more universally understood, reducing cognitive load for all parties. However, in radio environments prone to interference or when specific alphanumeric characters are crucial for identification, e.g., license plates, street names, unit designators, the phonetic alphabet provides a standardized, distinct pronunciation that minimizes confusion. This dual approach aligns with the principles of effective emergency communication, aiming for the fastest and most accurate transmission of information, as implicitly or explicitly guided by etc. certification standards that prioritize public safety and operational effectiveness. An incorrect approach that relies solely on plain language for all transmissions, even when critical identifiers are involved, fails to account for the inherent limitations of radio transmission and the potential for mishearing. This could lead to critical errors in dispatching or tracking resources. Conversely, an approach that exclusively uses the phonetic alphabet for every word would be inefficient and unnecessarily cumbersome, potentially slowing down vital communication and increasing the risk of listener fatigue or error. Over-reliance on the phonetic alphabet without considering the context and necessity for plain language is not best practice. Another incorrect approach might involve inventing or inconsistently applying phonetic spellings, which directly violates the standardized protocols designed to ensure universal understanding and would be a clear regulatory and ethical failure, undermining the core purpose of such systems. Professional decision-making in such situations requires a rapid assessment of the communication environment, the nature of the information being transmitted, and the potential consequences of misinterpretation. The etc. must consider factors like signal quality, the complexity of the message, and the need for absolute certainty regarding specific details. The guiding principle is always to achieve the clearest and most accurate communication possible, prioritizing safety and effective response. Question 4. When evaluating a situation where an emergency telecommunicator, etc., receives an emergency call and simultaneously notices a critical system anomaly affecting their console's functionality, what is the most appropriate course of action to ensure both immediate public safety and SAP operational integrity? Option A. Immediately disconnect the emergency call to focus on diagnosing and resolving the system anomaly. Option B. Attempt to troubleshoot and fix the system anomaly independently without reporting it, while still trying to manage the emergency call. Option C. Ignore the system anomaly and focus solely on handling the emergency call, assuming the anomaly will resolve itself. Option D. Continue to assist the caller while simultaneously initiating the SAP-established protocol for reporting system anomalies and potential security breaches. The correct answer is D. Continue to assist the caller while simultaneously initiating the SAP-established protocol for reporting system anomalies and potential security breaches. Explanation. This scenario is professionally challenging because it requires an emergency telecommunicator, etc., to balance immediate life-saving actions with the strict protocols governing SAP operations, specifically regarding the handling of sensitive information and the integrity of the dispatch system. The etc. must make a rapid judgment call that prioritizes public safety while adhering to established procedures. The correct approach represents best professional practice because it directly addresses the immediate threat to life, while simultaneously initiating the required procedural steps to maintain system integrity and inform relevant authorities. This aligns with the core ethical and regulatory mandate of the etc. to provide prompt and effective assistance in emergencies, adhering to established protocols for reporting system anomalies and potential security breaches, ensures that the SAP can continue to function effectively, and that any compromised information is addressed through appropriate channels, preventing further risk. This proactive and compliant response demonstrates a commitment to both immediate public safety and the long-term operational security of the SAP. An incorrect approach that involves ignoring the system anomaly to focus solely on the immediate call is professionally unacceptable. This failure to report a potential system compromise could have severe regulatory and ethical implications. It violates the principle of maintaining the integrity and security of the SAP communication systems, which is a fundamental requirement for reliable emergency response. Such an oversight could lead to further system failures, compromised data, or even a complete loss of communication capabilities during critical incidents, directly endangering public safety and violating the etc. duty of care. Another incorrect approach, such as immediately disconnecting the call to investigate the system anomaly, is also professionally unacceptable. This action prioritizes a potential technical issue over an active emergency, directly contravening the primary responsibility of the etc. to provide immediate assistance to individuals in distress. This would represent a significant ethical failure and a violation of regulatory requirements mandating prompt response to emergency calls. The potential for harm to the caller due to delayed or absent assistance is immense. A third incorrect approach, which involves attempting to fix the system anomaly without reporting it or continuing the call, is also professionally unsound. This bypasses established protocols for system troubleshooting and incident reporting. It creates a risk of further exacerbating the problem, potentially leading to a more severe system failure. Ethically and regulatorily, SAP are required to have documented procedures for handling technical issues. An unauthorized self-repair can compromise data, violate security protocols, and delay necessary support from qualified technical personnel, all of which can negatively impact emergency response capabilities. The professional decision-making process for similar situations should involve a rapid assessment of the immediate threat to life versus the nature and potential impact of the system anomaly. The etc. must prioritize the caller's safety and provide necessary assistance while simultaneously initiating the correct reporting procedures for any system issues. This involves a layered approach. First, ensure the caller's immediate needs are met. Second, follow established protocols for reporting technical anomalies, including potential security breaches. And third, cooperate with any subsequent investigation or resolution efforts. This ensures that both immediate life-saving efforts and the long-term operational integrity of the SAP are maintained. Question 5. Risk assessment procedures indicate that a caller reporting a residential fire may be experiencing difficulty breathing and speaking in short, choppy sentences. While the caller is providing details about the location and nature of the fire, what is the most appropriate immediate next step in call processing? Option A. Ask the caller to describe their breathing difficulties in detail before proceeding with any fire-related questions. Option B. Focus exclusively on gathering all available details about the fire, assuming the caller's breathing is unrelated to the emergency. Option C. Ask the caller if they are experiencing any difficulty breathing or feeling unwell, while continuing to gather essential fire details. Option D. Immediately dispatch the fire department and advise them of the caller's breathing difficulties without further inquiry. The correct answer is C. Ask the caller if they are experiencing any difficulty breathing or feeling unwell, while continuing to gather essential fire details. Explanation. This scenario presents a common challenge in emergency telecommunications, balancing the need for immediate, life-saving information with the potential for a caller to be experiencing a medical emergency that impairs their ability to provide clear details. The professional challenge lies in recognizing subtle cues that a caller might be in distress beyond the initial reported incident, and adapting call processing accordingly without causing undue alarm or delaying critical dispatch. Careful judgment is required to prioritize actions that will lead to the most effective and timely response. The correct approach represents best professional practice because it prioritizes the immediate safety of the caller and potential victims by seeking confirmation of the caller's own well-being, while simultaneously gathering essential incident details. This aligns with the core ethical and regulatory duty of an emergency telecommunicator, etc., to ensure the safety of all involved parties. By asking direct questions about the caller's condition and observing for signs of distress, the etc. is proactively identifying a potential secondary emergency, which is a critical component of comprehensive call processing and information gathering as outlined in etc. certification standards. This approach demonstrates a commitment to thoroughness and a proactive stance in managing unpredictable situations. An incorrect approach that focuses solely on the initial reported incident without assessing the caller's condition fails to meet the comprehensive information gathering requirements. This could lead to a delayed recognition of a medical emergency affecting the caller, potentially jeopardizing their life or the lives of others who might depend on them. It represents a regulatory failure to adhere to best practices in situational awareness and caller assessment. Another incorrect approach that immediately escalates to a higher priority without sufficient justification, or without attempting to gather more information, can lead to unnecessary resource deployment and potentially divert resources from other critical incidents. This is an inefficient use of emergency services and may not be supported by the established protocols for call prioritization, representing a procedural and ethical failure in resource management. A further incorrect approach that dismisses the caller's potential distress as irrelevant to the primary incident, or that fails to document observations of the caller's condition, is a significant ethical and regulatory lapse. Etc. are trained to recognize and respond to a spectrum of emergencies, and ignoring potential signs of distress is a failure to uphold the duty of care. This can also lead to incomplete or inaccurate incident logs, hindering post-incident analysis and training. The professional decision-making process for similar situations involves a continuous assessment loop. First, actively listen to the caller's words, tone, and any background noises. Second, identify the primary reported incident and begin standard information gathering. Third, concurrently look for any indicators of the caller's personal distress, e.g., slurred speech, difficulty breathing, confusion, emotional lability. Fourth, if distress is suspected, ask direct but non-alarming questions about their well-being. Fifth, based on the caller's response and your observations, adjust the call processing to address any emergent personal needs of the caller while still gathering critical incident information. Finally, document all observations and actions taken. Question 6. Governance review demonstrates that an emergency telecommunicator, etc., has received a call regarding a serious medical emergency. During the call, the etc. gathered sensitive personal health information and details about the caller's living situation. A colleague from a different department, who is not involved in the immediate emergency response, expresses concern for the caller and asks for their name and address. Later, the etc. supervisor, who is not directly managing this specific incident, inquires about the medical details of the emergency to understand potential resource strain. Additionally, an off-duty team member contacts the etc. out of curiosity to hear about the incident. Which of the following actions by the etc. best upholds confidentiality and privacy requirements? Option A. Politely decline to share any personal information with the colleague. Explain to the supervisor that medical details are confidential and offer to provide operational updates relevant to resource management. And firmly inform the off-duty team member that incident details are private and cannot be discussed. Option B. Share the caller's name and address with the colleague. Discuss the medical emergency with the supervisor in detail, and explain to the off-duty team member that while it's confidential, they can share some non-identifying details. Option C. Refuse to share any information with the colleague. Offer to provide the supervisor with a general overview of the incident without specific medical details, and tell the off-duty team member that the information is confidential, but offer to share it later when the incident is closed. Option D. Provide the caller's name and address to the concerned colleague. Share the medical details with the supervisor to inform them about the situation, and give the off-duty team member a brief overview of the incident. The correct answer is A. Politely decline to share any personal information with the colleague. Explain to the supervisor that medical details are confidential and offer to provide operational updates relevant to resource management. And firmly inform the off-duty team member that incident details are private and cannot be discussed. Explanation. Scenario analysis. This scenario presents a common yet critical challenge for emergency telecommunicators, etc., balancing the immediate need for information during an emergency with the fundamental right to privacy and the legal obligation to maintain confidentiality. The etc. is privy to sensitive personal details of individuals involved in a critical incident, and the pressure to share this information, even with seemingly well-intentioned colleagues outside the direct incident response, can be immense. The challenge lies in discerning what information is permissible to share, with whom, and under what circumstances, without violating privacy regulations or ethical codes. Correct approach analysis. The correct approach prioritizes adherence to established protocols and legal mandates regarding confidentiality. In the context of emergency telecommunications, this means strictly limiting the dissemination of protected health information, PHI, and other personally identifiable information, PI, to only those individuals directly involved in the immediate response and who have a legitimate need to know. This aligns with regulations such as HIPAA in the U.S., which mandates strict controls over PHI. Sharing information only on a need-to-know basis ensures that privacy is protected, legal obligations are met, and the integrity of the emergency response is maintained by preventing unnecessary disclosure that could lead to identity theft, discrimination, or other harms. Incorrect approach is analysis. Sharing the caller's name and address with a colleague in another department who expresses concern for the caller's well-being, even if the colleague is not directly involved in the current incident, represents a breach of confidentiality. This is because the colleague does not have a direct, immediate need to know this specific information for the purpose of responding to the emergency. This action violates the principle of least privilege and potentially contravenes privacy laws by disclosing PII without proper authorization or a clear, documented need. Discussing the details of the medical emergency with a supervisor who is not actively managing the incident, even if the supervisor is seeking to understand operational challenges, is also a failure. While supervisors need situational awareness, the specific medical details of a caller are confidential. The supervisor should be provided with operational updates relevant to resource allocation or response strategy, not sensitive personal health information, unless that information is directly pertinent to the supervisor's role in managing the incident response itself. This disclosure risks unauthorized access and dissemination of PHI. Providing a summary of the incident, including the caller's personal circumstances, to a team member who is off-duty and inquiring out of curiosity, is a clear violation of confidentiality. This is driven by personal interest rather than operational necessity, and exposes sensitive information to an individual who has no role in the current emergency response. This action undermines trust and demonstrates a disregard for the privacy rights of the individual involved. Professional reasoning, etc. must operate within a strict decision-making framework that prioritizes legal compliance and ethical conduct. When faced with requests for information, the primary questions to ask are: is this information protected? Does the recipient have a legitimate, documented need to know this information for the purpose of responding to the emergency? Am I authorized to share this information under current protocols and regulations? If there is any doubt, the etc. should err on the side of caution, consult established protocols, or seek guidance from a supervisor or legal counsel. This systematic approach ensures that confidentiality is maintained, privacy is respected, and the etc. acts as a responsible steward of sensitive information. Question 7. Benchmark analysis indicates that during a multi-jurisdictional hazardous materials incident, telecommunicators from different responding agencies are present at the scene. To ensure effective information exchange and coordinated response, which communication strategy best adheres to established emergency telecommunicator, etc., certification standards regarding interoperability? Option A. Prioritizing the use of personal mobile devices for communication due to their widespread availability, even if they do not integrate with official emergency response systems. Option B. Utilizing pre-established, interoperable communication channels and protocols designed for multi-agency coordination, ensuring seamless information flow between all responding units. Option C. Relying exclusively on the communication equipment and protocols of the lead responding agency, assuming other agencies will be able to adapt their systems to match. Option D. Establishing direct, ad hoc radio frequencies between the primary responding agencies, bypassing any existing interoperable systems to expedite communication. The correct answer is B. Utilizing pre-established, interoperable communication channels and protocols designed for multi-agency coordination, ensuring seamless information flow between all responding units. Explanation. Scenario analysis. This scenario presents a common challenge in emergency telecommunications, ensuring seamless communication across different agencies and jurisdictions during a large-scale incident. The professional difficulty lies in the inherent complexities of interoperability, which involves technical compatibility, procedural alignment, and adherence to established communication standards. Failure to achieve effective interoperability can lead to critical delays, miscommunication, and potentially compromised public safety outcomes. Careful judgment is required to select the most appropriate communication strategy that aligns with established protocols and maximizes the effectiveness of the emergency response. Correct approach analysis. The correct approach prioritizes the use of established, interoperable communication systems and protocols that have been predefined and tested for multi-agency use. This aligns with the fundamental principles of emergency telecommunications, which emphasize standardization and reliability. By leveraging existing interoperable solutions, telecommunicators ensure that information can be shared accurately and efficiently between different responding units, regardless of their primary communication equipment. This approach is directly supported by regulatory frameworks that mandate or strongly encourage the adoption of interoperable communication systems to enhance public safety response capabilities. It represents best professional practice because it is proactive, compliant, and focused on operational effectiveness during a crisis. Incorrect approach is analysis. One incorrect approach involves attempting to establish ad hoc, direct communication channels without utilizing pre-existing interoperable systems. This is a regulatory and ethical failure because it bypasses established protocols designed for reliability and security. Such an approach increases the risk of technical incompatibility, signal interference, and unauthorized access, potentially compromising the integrity of the communication. It also fails to leverage the investments made in interoperable infrastructure and training. Another incorrect approach is to rely solely on the communication capabilities of a single primary agency, assuming other responding entities will adapt. This is a failure of professional responsibility and regulatory compliance. Emergency telecommunication standards are built on the premise of mutual support and shared situational awareness. A single agency focus ignores the need for seamless information flow between all responding parties, hindering coordinated efforts and potentially leading to duplicated or conflicting actions. A third incorrect approach is to prioritize personal familiarity with a specific communication system over its interoperability with other agencies. While familiarity can breed efficiency, it is professionally unacceptable when it compromises the ability to communicate with critical partners during an emergency. Regulatory frameworks for emergency telecommunications emphasize the collective good and the need for systems that facilitate interagency cooperation, not individual preference. Professional reasoning. Professionals should employ a decision-making framework that begins with an assessment of the incident scope and the agencies involved. This assessment should then be cross-referenced with established interoperability plans and communication protocols. The primary consideration should always be the ability to communicate effectively with all relevant responding entities. If existing interoperable systems are insufficient, the next step involves activating predefined contingency plans for enhanced interoperability, rather than improvising. Ethical considerations demand prioritizing public safety through clear, reliable, and coordinated communication. Question 8. The risk matrix shows a high-priority incident flagged by the GIS system at a specific location, but the telecommunicator recalls a recent road closure in that exact area that is not yet reflected in the GIS data. Which of the following actions best demonstrates adherence to emergency telecommunicator, etc. certification standards regarding mapping and GIS? Option A. Attempt to verify the accuracy of the GIS data by cross-referencing with other available real-time information sources, or by consulting with field units if possible, before dispatching, to ensure responders are directed to the most accessible and appropriate location. Option B. Dispatch responders to a nearby known safe location and instruct them to proceed to the flagged incident area to conduct their own reconnaissance, as the GIS data may be unreliable. Option C. Immediately dispatch emergency responders to the location indicated by the risk matrix, assuming the GIS data is the most current and accurate representation of the situation. Option D. Delay dispatch indefinitely until the GIS system is updated to reflect the road closure, prioritizing data integrity over immediate response. The correct answer is C. Immediately dispatch emergency responders to the location indicated by the risk matrix, assuming the GIS data is the most current and accurate representation of the situation. Explanation. This scenario is professionally challenging because it requires an emergency telecommunicator, etc., to interpret and act upon spatial data presented in a risk matrix, which directly impacts resource allocation and response strategies during an emergency. The etc. must understand the limitations and capabilities of the Geographic Information System, GIS data, and its integration with the risk matrix to ensure accurate and timely dispatch. The correct approach represents best professional practice because it prioritizes the verification of the GIS data's accuracy and completeness against known, reliable sources before committing resources based solely on the risk matrix. This aligns with the fundamental principle of ensuring the safety and well-being of the public by responding to actual, verified conditions rather than potentially flawed or outdated digital representations. Adherence to established protocols for data validation and cross-referencing is paramount in emergency services to prevent misallocation of critical resources and to ensure the most effective response. An incorrect approach that relies solely on the risk matrix without verification fails to acknowledge the inherent potential for errors in GIS data, such as outdated maps, inaccurate geocoding, or system glitches. This could lead to dispatching emergency responders to incorrect locations, delaying critical aid, or sending them into situations where their safety is compromised due to a lack of accurate situational awareness. Ethically, this failure constitutes negligence, as it deviates from the duty of care owed to the public and to the responders. Regulatory frameworks for etc. certification emphasize accuracy and diligence in information processing, and a blind reliance on automated or semi-automated data without human oversight and validation would violate these standards. Another incorrect approach that involves immediately dispatching based on the highest risk score, without considering the context or potential for false positives, demonstrates a lack of critical thinking and an over-reliance on a single data point. This can lead to unnecessary resource deployment, straining limited emergency services, and potentially leaving other areas vulnerable. It also fails to account for the dynamic nature of emergencies, where conditions can change rapidly, and the risk matrix might not reflect the most current situation. A third incorrect approach that involves delaying dispatch to conduct an exhaustive manual map review of every potential incident shown on the risk matrix, even for low-priority areas, would be inefficient and counterproductive. While verification is crucial, the process must be balanced with the urgency of emergency response. This approach prioritizes an impractical level of detail over timely action, potentially leading to significant delays in response to genuine emergencies. The professional decision-making process for similar situations should involve a tiered approach. First, interpret the risk matrix and identify potential incident locations. Second, prioritize verification based on the severity of the risk indicated and the urgency of the situation. This may involve cross-referencing with other available data sources, such as caller information, real-time traffic data, or weather alerts. Third, if discrepancies or uncertainties arise, escalate for further clarification or manual verification, but only to the extent necessary to ensure accurate dispatch without causing undue delay. Finally, dispatch resources based on the most accurate and up-to-date information available, maintaining clear communication with responding units regarding any known uncertainties. Question 9. Process analysis reveals that an emergency telecommunicator, etc., receives a 911 call from a mobile phone. The enhanced 911E911 system displays a location that appears to be a general vicinity but not a specific street address. The caller sounds distressed and is speaking rapidly, mentioning a fire in my house. The etc. needs to ensure the fastest and most accurate dispatch of emergency services. Which of the following actions best represent the etc. immediate and most critical responsibility regarding obtaining caller location? Option A. Immediately dispatch emergency services to the general vicinity provided by the E911 system, while simultaneously asking the caller for a more specific address or cross street. Option B. Rely solely on the initial E911 location data and proceed with dispatch without further questioning, assuming the caller will be able to direct responders once they arrive in the general area. Option C. Inform the caller that the E911 location is not precise enough and instruct them to stay on the line until a specific address can be confirmed, delaying dispatch. Option D. Place the caller on hold to attempt to manually triangulate the caller's precise GPS coordinates from their mobile device before initiating any dispatch. Correct answer is A. Immediately dispatch emergency services to the general vicinity provided by the E911 system, while simultaneously asking the caller for a more specific address or cross street. Explanation. This scenario presents a common yet critical challenge for emergency telecommunicators, etc. Obtaining accurate caller location information in a dynamic and potentially chaotic situation. The professional challenge lies in balancing the urgency of the call with the need for precise location data, which is paramount for efficient and effective emergency response. The etc. must navigate potential technical limitations, caller distress, and the critical time sensitivity of the incident. The correct approach prioritizes immediate and persistent efforts to obtain the most accurate location data available, utilizing all available tools and techniques in accordance with established protocols and regulatory guidelines. This represents best professional practice because it directly aligns with the primary objective of emergency telecommunication, ensuring that responders can reach the incident location swiftly and safely. Adherence to protocols for obtaining and verifying location information, such as utilizing enhanced 911E911 system capabilities and employing active questioning techniques, is a regulatory and ethical imperative. These protocols are designed to maximize the chances of successful dispatch and minimize response delays, thereby protecting lives and property. An incorrect approach that relies solely on the initial, potentially inaccurate, location provided by the E911 system without further verification or active questioning fails to meet professional standards. This approach risks dispatching responders to the wrong location, leading to critical delays in aid, potential harm to the caller or others, and a breach of the etc. duty of care. Ethically, it demonstrates a lack of diligence and a failure to exhaust all reasonable means to secure vital information. Another incorrect approach that involves delaying the dispatch of resources while attempting to triangulate a precise GPS coordinate from a mobile device without first obtaining a confirmed address or a reasonable approximation is also professionally unacceptable. This delays critical response times and may not yield accurate enough information for dispatch. Regulations mandate that etc. initiate dispatch based on the best available location information when immediate, precise data is unobtainable, rather than waiting for potentially elusive perfect data. Finally, an approach that dismisses the caller's description of their location because it does not perfectly match the E911 data, without attempting to reconcile the discrepancy or gather further clarifying details, is a significant professional and ethical failure. This demonstrates a lack of active listening and problem-solving skills, potentially ignoring crucial contextual information provided by the caller that could lead to the correct location. It also violates the principle of treating all information provided by the caller as potentially valid until verified. The professional decision-making process for similar situations should involve a systematic approach. 1. Acknowledge and record the initial E911 location data. 2. Immediately engage the caller with clear, concise questions to confirm or refine the location. 3. Utilize all available system tools, e.g., E911 mapping ALI data, to verify and supplement caller-provided information. 4. If discrepancies exist, actively work to resolve them through further questioning and cross-referencing. 5. If a precise address cannot be immediately obtained, gather the best available descriptive location information, e.g., nearest intersection, landmarks, direction of travel. 6. Follow established protocols for dispatching based on the best available location information, even if it is not perfectly precise when time is of the essence. 7. Continuously attempt to refine location information if the situation allows without compromising initial response. Question 10. Governance review demonstrates that emergency telecommunication center protocols are designed to optimize response times and outcomes. When a caller reports a complex, multifaceted emergency, which approach best aligns with these optimization principles? Option A. Focus on delivering pre-approved, step-by-step instructions for immediate safety and hazard mitigation while systematically collecting essential emergency information. Option B. Attempt to provide advanced medical advice and diagnostic opinions based on the caller's descriptions to guide their self-treatment. Option C. Immediately begin gathering detailed background information on the caller's personal history to establish rapport before proceeding with emergency details. Option D. Prioritize collecting a comprehensive narrative of the entire event, including minor details, before requesting critical information like location and nature of the emergency. The correct answer is C. Immediately begin gathering detailed background information on the caller's personal history to establish rapport before proceeding with emergency details. Explanation. Scenario analysis. This scenario presents a common challenge in emergency telecommunications, balancing the need for rapid information gathering with the imperative to provide accurate and actionable guidance to callers in distress. The telecommunicator must quickly assess the situation, prioritize critical information, and deliver instructions that are both effective and safe, all while managing the caller's emotional state. This requires a high degree of situational awareness, communication skill, and adherence to established protocols. Correct approach analysis. The correct approach emphasizes a structured, protocol-driven method for information gathering and instruction delivery. This aligns directly with the core principles of emergency telecommunications, which are designed to ensure consistency, accuracy, and efficiency in high-stress situations. By prioritizing the collection of essential details, nature of the emergency, location, caller information, and then providing clear, concise, and pre-approved instructions, the telecommunicator maximizes the chances of a positive outcome and ensures that responding units receive the most critical information first. This systematic approach is fundamental to the emergency telecommunicator, etc. certification syllabus, focusing on process optimization for effective emergency response. Incorrect approach is analysis. An approach that focuses solely on calming the caller without gathering essential information is procedurally flawed. While empathy is important, it cannot supersede the primary duty to obtain critical details needed for dispatch and response. This failure to adhere to established protocols for information gathering could delay vital resources or send them to an incorrect location, directly violating the principles of process optimization for emergency services. An approach that attempts to provide medical advice beyond the scope of established protocols is dangerous and ethically unsound. Emergency telecommunicators are trained to deliver specific, pre-approved instructions, not to diagnose or treat. Deviating from these protocols can lead to harm to the caller or patient and exposes the telecommunicator and agency to significant liability. This represents a failure in process optimization by introducing unverified and potentially harmful steps. An approach that prioritizes gathering non-essential details before critical information is inefficient and potentially hazardous. While a comprehensive understanding of the situation is eventually needed, the immediate priority must be on information that directly facilitates an effective and timely response. Delaying the collection of vital data like location or the nature of the emergency in favor of less critical details undermines the optimized processes designed for emergency dispatch. Professional reasoning. Professionals should employ a decision-making framework that prioritizes adherence to established protocols, systematic information gathering, and clear, concise communication. This framework involves active listening, rapid assessment of the situation, and the application of learned skills and knowledge to deliver the most effective response within the defined scope of practice. When faced with a challenging situation, telecommunicators should rely on their training and the agency's standard operating procedures to guide their actions, ensuring that every step taken contributes to the overall optimization of the emergency response process. Question 11. The audit findings indicate that during a high-stress medical emergency call, the telecommunicator's initial response focused exclusively on obtaining the patient's address and vital signs, without acknowledging the caller's audible distress and panic breathing, which approach best addresses the identified deficiency in identifying and addressing caller emotions. Option A. The telecommunicator should have first used phrases like, "I understand you're scared, and I'm here to help," to validate the caller's emotions before proceeding with information gathering. Option B. The telecommunicator should have instructed the caller to calm down and take deep breaths before asking any further questions. Option C. The telecommunicator should have immediately transferred the call to a supervisor to handle the caller's emotional state. Option D. The telecommunicator should have prioritized gathering as much detailed medical history as possible, assuming the caller would eventually provide the address. The correct answer is A. The telecommunicator should have first used phrases like, "I understand you're scared, and I'm here to help," to validate the caller's emotions before proceeding with information gathering. Explanation. Scenario analysis. This scenario is professionally challenging because the telecommunicator must balance the immediate need for critical information with the caller's heightened emotional state. The caller's distress can impede their ability to provide clear, concise details, potentially delaying vital response. The telecommunicator's judgment is crucial in de-escalating the situation while simultaneously gathering necessary data, ensuring both the caller's well-being and the effectiveness of the emergency response. Correct approach analysis. The correct approach demonstrates best professional practice by prioritizing the caller's emotional state to facilitate information gathering. Acknowledging and validating the caller's feelings, such as fear or panic, helps build rapport and trust. This empathetic response can calm the caller, making them more receptive to instructions and more capable of providing accurate details about the emergency. This aligns with ethical guidelines for emergency telecommunication, which emphasize compassionate and effective communication, and regulatory frameworks that often mandate a focus on caller welfare and efficient information acquisition. Incorrect approaches analysis. One incorrect approach fails by solely focusing on information extraction without acknowledging the caller's distress. This can exacerbate the caller's panic, leading to fragmented or inaccurate information and potentially violating ethical obligations to provide a supportive and humane interaction. It disregards the psychological impact of emergencies on individuals. Another incorrect approach involves becoming overly involved in the caller's emotional narrative, diverting critical time and resources from the primary objective of gathering essential emergency details. Empathy is important. Excessive emotional engagement can hinder the telecommunicator's ability to manage the call effectively and efficiently, potentially delaying the dispatch of appropriate services. This deviates from the professional duty to manage the call with a focus on resolution. A further incorrect approach is to dismiss or minimize the caller's emotions, perhaps by using dismissive language or rushing the caller. This is ethically unsound as it demonstrates a lack of empathy and can further distress the caller, making them less cooperative. It also fails to meet the professional standard of care expected in emergency telecommunication, which requires sensitivity and responsiveness to the caller's condition. Professional reasoning. Professionals should employ a structured approach that begins with active listening to assess the caller's emotional state. Upon identifying distress, the telecommunicator should use empathetic statements to acknowledge and validate these feelings. This should be followed by clear, concise, and reassuring communication, guiding the caller through the necessary information gathering process. The telecommunicator must maintain control of the call, gently redirecting the conversation back to the critical details needed for response while continuing to offer support. This balanced approach ensures both the caller's emotional needs and the operational requirements of the emergency are met. Question 12. Market research demonstrates that SAP are increasingly reliant on interconnected systems for efficient emergency response, yet face growing cybersecurity threats. Considering the paramount importance of protecting sensitive caller data and ensuring uninterrupted service, which of the following strategies best balances operational needs with robust network and data security requirements for an emergency telecommunicator, etc. certification context? Option A. Disabling all remote access to SAP systems and prohibiting the use of any cloud-based services to minimize external exposure. Option B. Implementing a comprehensive security framework that includes end-to-end encryption for all data transmissions, granular access controls, regular vulnerability assessments, and a well-defined incident response plan. Option C. Relying primarily on strong, unique passwords for all user accounts and conducting annual training on basic phishing awareness for all SAP personnel. Option D. Focusing exclusively on physical security measures for the SAP facility, such as reinforced doors and surveillance cameras, while assuming network security is adequately managed by external vendors. Correct answer is B. Implementing a comprehensive security framework that includes end-to-end encryption for all data transmissions, granular access controls, regular vulnerability assessments, and a well-defined incident response plan. Explanation. This scenario presents a common challenge in public safety answering points, SAP, where the need for rapid information sharing for emergency response must be balanced against stringent data security requirements. The professional challenge lies in ensuring that while critical data flows to first responders, it does not become vulnerable to unauthorized access or breaches, which could compromise public safety and violate privacy regulations. Careful judgment is required to implement security measures that are effective without hindering essential communication during emergencies. The correct approach prioritizes a multi-layered security strategy that aligns with federal mandates for data protection and SAP operational integrity. This involves employing robust encryption for data in transit and at rest, implementing strict access controls based on the principle of least privilege, and conducting regular security audits and vulnerability assessments. This approach represents best professional practice because it directly addresses the core tenets of network and data security as mandated by regulations such as HIPAA for protected health information that might be incidentally disclosed, and NIST guidelines, which are often incorporated into state and local SAP operational standards. It ensures data confidentiality, integrity, and availability, which are paramount for both operational efficiency and legal compliance. An incorrect approach that relies solely on basic password protection for network access fails to meet the required security standards. This is a significant regulatory and ethical failure because it leaves sensitive caller information and SAP operational data exposed to unauthorized access, violating privacy laws and potentially compromising ongoing investigations or emergency responses. Another incorrect approach, which involves disabling all remote access capabilities without providing secure alternatives, is also professionally unacceptable. While it attempts to prevent breaches, it severely hampers the ability to share critical information with off-site command centers or mutual aid partners during large-scale incidents, directly impacting public safety and potentially violating directives that mandate interoperability and information sharing for effective emergency management. A third incorrect approach, focusing only on physical security of the SAP building without addressing network vulnerabilities, is insufficient. This overlooks the pervasive threat of cyber attacks and data exfiltration, which can occur remotely, leaving the SAP and its data exposed despite robust physical safeguards. Professionals should employ a risk-based decision-making process. This involves identifying potential threats and vulnerabilities, assessing their impact, and implementing controls that are proportionate to the risk. It requires staying abreast of evolving cybersecurity threats and regulatory requirements, fostering a culture of security awareness among all staff, and regularly reviewing and updating security protocols. Collaboration with IT security professionals and adherence to established cybersecurity frameworks are essential components of this process. Question 13. Quality control measures reveal an instance where a telecommunicator received a call from an individual who, due to a speech impediment, was speaking very slowly and with difficulty articulating certain words. The telecommunicator, in an effort to expedite the call, began to interrupt the caller frequently to finish their sentences and asked leading questions that assumed the nature of the emergency. Which of the following actions best demonstrates adherence to best practices for communicating with individuals with disabilities in an emergency telecommunications setting? Option A. Speak louder and enunciate more clearly, assuming the speech impediment is the sole reason for the difficulty in understanding, and proceed with standard questioning. Option B. Politely inform the caller that due to the difficulty in understanding, the call will be terminated and they should attempt to have someone else call. Option C. Immediately ask the caller if they require a sign language interpreter, even though the call is via voice, to ensure all communication needs are met. Option D. Patiently listen to the caller, allowing them to speak at their own pace, and ask open-ended questions to encourage them to provide information in their own words, confirming understanding periodically. The correct answer is D. Patiently listen to the caller, allowing them to speak at their own pace, and ask open-ended questions to encourage them to provide information in their own words, confirming understanding periodically. Explanation. This scenario is professionally challenging because it requires the telecommunicator to adapt standard communication protocols to accommodate an individual with a specific disability, ensuring effective information exchange and appropriate response without making assumptions or causing distress. The challenge lies in balancing the need for clear, concise information with the sensitivity required when interacting with someone who may have communication barriers. The correct approach represents best professional practice because it prioritizes active listening, clear and simple language, and confirmation of understanding, all while respecting the individual's communication method. This aligns with the ethical imperative to provide equitable service to all individuals, regardless of their communication abilities, and adheres to guidelines that emphasize patient-centered communication and the use of appropriate aids or methods when necessary. Specifically, it reflects the principles of ensuring that all individuals receive the information they need in a format they can understand, which is crucial for effective emergency response and public safety. An incorrect approach that relies on assumptions about the individual's capabilities or communication preferences is a significant regulatory and ethical failure. It can lead to misinterpretation of the emergency, delayed or inappropriate response, and a violation of the individual's right to effective communication. For example, assuming a person with a known disability cannot provide critical information or attempting to speak louder without confirming it is necessary can be patronizing and ineffective, potentially hindering the telecommunicator's ability to gather vital details. Another failure would be to dismiss or ignore the individual's attempts to communicate through a specific method, thereby failing to utilize all available information channels. Professionals should employ a decision-making framework that begins with an open mind and a commitment to understanding the caller's needs. This involves active listening, asking clarifying questions, and being prepared to adapt communication strategies. If a disability is apparent or disclosed, the telecommunicator should inquire respectfully about the best way to communicate. The goal is always to obtain the necessary information to dispatch the appropriate resources and provide assistance, while treating the individual with dignity and respect. Question 14. The efficiency study reveals that emergency telecommunicators, etc., often struggle to effectively manage callers experiencing high levels of distress while simultaneously gathering critical incident information. Considering the paramount importance of both caller well-being and accurate data collection, which communication strategy best exemplifies professional best practice for an etc. in such a situation? Option A. Engage in extensive personal reassurance and offer detailed advice on how to handle the situation, prioritizing the caller's emotional comfort over immediate information gathering. Option B. Utilize technical jargon and complex terminology to convey the seriousness of the situation and ensure the caller understands the procedural steps involved in emergency response. Option C. Employ active listening techniques, using a calm and reassuring tone, acknowledging the caller's distress, and asking clear, concise questions to elicit necessary information while building rapport. Option D. Immediately interrupt the caller to demand specific details like location and nature of the incident, overriding their emotional outpouring to ensure critical data is obtained first. The correct answer is D. Immediately interrupt the caller to demand specific details like location and nature of the incident, overriding their emotional outpouring to ensure critical data is obtained first. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the emergency telecommunicator, etc., to balance the immediate need for information with the caller's emotional state. The caller is experiencing a high-stress event, which can impair their ability to communicate clearly and coherently. The etc. must remain calm, empathetic, and focused on gathering critical details, while also providing reassurance and guidance. Failure to manage this dynamic can lead to delayed response, miscommunication, and a negative impact on the caller's experience and the outcome of the emergency. Correct approach analysis. The correct approach prioritizes active listening and empathetic communication. This involves acknowledging the caller's distress, using a calm and reassuring tone, and asking clear, concise questions. By mirroring the caller's language where appropriate and offering verbal cues of understanding e.g., I understand, tell me more, the etc. builds rapport and encourages the caller to provide necessary information. This aligns with best practices in emergency telecommunication, emphasizing the human element of communication alongside the procedural requirements. Regulatory frameworks for etc. often mandate clear, concise, and empathetic communication to ensure effective information gathering and caller support during emergencies. Incorrect approaches analysis. One incorrect approach involves immediately interrupting the caller to demand specific information without acknowledging their distress. This can escalate the caller's anxiety, make them feel unheard, and hinder their ability to recall or articulate crucial details. Ethically, this demonstrates a lack of empathy and professionalism, failing to meet the caller's immediate emotional needs. It also risks violating guidelines that emphasize maintaining a calm demeanor and building rapport. Another incorrect approach is to become overly conversational or to offer extensive personal reassurance that deviates from the primary goal of gathering emergency information. While empathy is crucial, excessive non-essential conversation can delay critical information exchange, potentially impacting response times. This approach may also lead to the etc. inadvertently providing advice outside their scope of practice, or creating a false sense of security that prevents the caller from taking necessary immediate actions. This could be seen as a failure to adhere to protocols for efficient emergency response. A third incorrect approach is to use jargon or technical terms that the caller may not understand, especially in a high-stress situation. This creates a communication barrier, leading to confusion and frustration. It directly contradicts the requirement for clear and concise communication, which is fundamental for effective emergency telecommunication. Such a failure can result in misinterpretation of instructions or a reluctance from the caller to ask for clarification, thereby jeopardizing the emergency response. Professional reasoning. Professionals should employ a decision-making process that begins with assessing the caller's emotional state and immediate needs. Active listening, empathetic acknowledgement, and clear, concise questioning should be integrated. The etc. must constantly evaluate the flow of information, adapting their communication style to the caller's responses while remaining focused on obtaining essential details for dispatch. This involves a continuous feedback loop of listening, understanding, questioning, and reassuring, all within the framework of established emergency protocols. Question 15. The performance metrics show a consistent, albeit minor, degradation in audio clarity on a primary emergency dispatch channel over the past 72 hours. What is the most appropriate immediate action for an emergency telecommunicator, etc., to take? Option A. Initiate a formal trouble ticket with the telecommunications provider and consult the equipment's technical manual for basic troubleshooting steps. Option B. Continue monitoring the channel, assuming the degradation is within acceptable operational tolerances until a complete failure occurs. Option C. Manually adjust the squelch settings on all available radios to compensate for the perceived audio degradation. Option D. Immediately request a system-wide radio test to identify if the issue is widespread. The correct answer is A. Initiate a formal trouble ticket with the telecommunications provider and consult the equipment's technical manual for basic troubleshooting steps. Explanation. This scenario presents a professional challenge because it requires an emergency telecommunicator, etc., to interpret performance data related to telecommunications equipment and make a judgment call that impacts public safety and operational efficiency. The challenge lies in balancing immediate operational needs with long-term equipment reliability and compliance with established protocols. Careful judgment is required to avoid compromising response times or violating regulatory standards. The correct approach represents best professional practice because it prioritizes a systematic, data-driven investigation aligned with regulatory requirements for maintaining reliable communication systems. This involves verifying the reported issues, consulting technical support, and documenting all actions. This aligns with the overarching ethical and regulatory duty of an etc. to ensure that communication equipment functions optimally to facilitate timely and accurate emergency response, as mandated by relevant telecommunications regulations and public safety guidelines. An incorrect approach that immediately escalates the issue without proper verification fails to adhere to established troubleshooting protocols and could lead to unnecessary disruption or resource allocation. This could be a regulatory failure if it bypasses mandated diagnostic procedures, or an ethical failure if it creates a false sense of urgency that impacts other critical functions. Another incorrect approach that involves ignoring the performance metrics until a critical failure occurs is a direct violation of the duty to maintain operational readiness. This represents a significant regulatory failure, as it demonstrates a disregard for equipment maintenance and monitoring requirements, potentially leading to communication breakdowns during emergencies. Ethically, it is a dereliction of duty to the public. A further incorrect approach that involves making assumptions about the cause of the performance issues without consulting technical documentation or support overlooks the need for expert knowledge and adherence to manufacturer specifications. This can lead to improper troubleshooting, potentially exacerbating the problem or causing further equipment damage, which is both a regulatory and ethical failing. The professional reasoning process for similar situations should involve 1. Acknowledging and documenting the performance data. 2. Initiating a preliminary assessment based on established protocols. 3. Consulting relevant technical documentation and support resources. 4. Escalating the issue according to defined procedures if preliminary assessment is inconclusive or indicates a significant problem. 5. Documenting all steps taken and their outcomes. This systematic approach ensures compliance, efficiency, and the highest level of public safety. Question 16. Compliance review shows that during a high-stress emergency call, an emergency telecommunicator, etc., initially asked the caller to describe what was happening in their own words. Following this, the etc. then asked a series of specific questions to confirm the exact address, the type of emergency, and if anyone was injured. Which questioning technique best describes the etc. initial approach to gathering information? Option A. Employing a rapid succession of closed-ended questions to quickly ascertain facts. Option B. Relying solely on the caller's narrative without seeking specific confirmations. Option C. Interrupting the caller frequently to clarify minor details. Option D. Primarily using open-ended questions to allow the caller to provide details freely. The correct answer is D. Primarily using open-ended questions to allow the caller to provide details freely. Explanation. Scenario analysis. This scenario presents a professional challenge because the telecommunicator must balance the urgency of an emergency with the need to gather accurate, actionable information. The caller's emotional state and potential for providing incomplete or misleading information due to distress require a skilled application of questioning techniques. The telecommunicator's judgment is critical in determining the most effective way to elicit necessary details without overwhelming the caller or delaying vital response. Correct approach analysis. The correct approach involves using open-ended questions initially to allow the caller to provide information in their own words, which can reveal crucial details that might be missed with premature closed-ended questioning. This aligns with best practices in emergency telecommunication by prioritizing comprehensive information gathering and establishing rapport. Regulations and ethical guidelines for emergency telecommunicators, etc., emphasize the importance of active listening and allowing the caller to articulate their situation, thereby ensuring all relevant facts are captured before narrowing the focus. This method respects the caller's experience and can lead to a more complete understanding of the emergency. Incorrect approach is analysis, an approach that immediately resorts to a series of rapid, closed-ended questions, while seemingly efficient, can be professionally unacceptable. This can alienate a distressed caller, cause them to feel unheard, and potentially lead to the omission of critical information because they are not given the opportunity to volunteer it. Ethically, it fails to demonstrate empathy and can hinder the telecommunicator's ability to accurately assess the situation. It may also violate guidelines that stress the importance of a calm and controlled interaction, even under pressure. Another incorrect approach would be to solely rely on open-ended questions without transitioning to more specific, closed-ended questions when necessary. This can lead to an inefficient information gathering process, wasting valuable time in an emergency. While open-ended questions are good for initial assessment, failing to use closed-ended questions to confirm details or obtain specific facts, like exact location or number of victims, can delay the dispatch of appropriate resources. This can be seen as a failure to meet the core responsibility of an etc. to obtain precise, actionable data. A third incorrect approach would be to interrupt the caller frequently to clarify minor points or to ask questions that are not immediately relevant to the emergency. This demonstrates poor listening skills and can frustrate the caller, making them less cooperative. It also shows a lack of professional judgment in prioritizing information. Such behavior can be contrary to training standards that emphasize maintaining control of the call while allowing the caller to speak, and it can lead to the telecommunicator missing more critical information due to their focus on less important details. Professional reasoning. Professionals should employ a tiered questioning strategy. Begin with broad, open-ended questions to understand the overall situation and allow the caller to express themselves. As information is gathered, transition to more specific, closed-ended questions to confirm details, obtain precise locations, identify the nature of the emergency, and gather information about the number of individuals involved and their conditions. This systematic approach ensures comprehensive data collection while maintaining efficiency and demonstrating empathy and control throughout the interaction. Professionals must constantly assess the caller's state and the evolving nature of the emergency to adapt their questioning techniques accordingly. Question 17. Stakeholder feedback indicates that during a residential fire incident, telecommunicators sometimes struggle with the optimal sequence of information gathering and instruction provision. Considering the critical nature of fire dispatch, which of the following approaches best aligns with established emergency telecommunicator, etc., certification protocols, and best practices for ensuring both rapid response and caller safety? Option A. Focus on calming the caller by asking about their emotional state and what they are seeing before attempting to gather any location or incident-specific information. Option B. Instruct the caller to evacuate the building immediately if it is safe to do so, then ask for the exact address of the fire. And finally, request they remain on the line to provide further details. Option C. Immediately request the caller's name and contact number. Then ask detailed questions about the fire's size and origin before dispatching any units. Option D. Ask for the exact address of the fire. Then instruct the caller to stay on the line and evacuate if it is safe to do so, while simultaneously relaying the address to dispatch for immediate unit assignment. The correct answer is C. Immediately request the caller's name and contact number. Then ask detailed questions about the fire's size and origin before dispatching any units. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the emergency telecommunicator, etc., to balance the immediate need for accurate information with the potential for panic or misinterpretation by a caller experiencing a high-stress event. The etc. must quickly assess the situation, prioritize critical information, and provide clear, actionable instructions without overwhelming the caller or compromising the integrity of the dispatch process. The inherent chaos of a fire incident, coupled with the caller's emotional state, necessitates a calm, structured, and protocol-driven response. Correct approach analysis. The correct approach prioritizes gathering essential information for dispatch while simultaneously providing immediate, life-saving instructions. This aligns with the core principles of emergency telecommunication, which mandate efficient information exchange and the provision of pre-arrival instructions to mitigate harm. By asking for the address first, the etc. ensures that the primary resource, fire apparatus, can be dispatched without delay. Simultaneously, instructing the caller to stay on the line and evacuate if safe demonstrates adherence to protocols that emphasize caller safety and continued communication. This approach is ethically sound as it prioritizes life safety and adheres to established best practices for fire dispatch, which are often codified in state or national standards for emergency services. Incorrect approach is analysis. An approach that focuses solely on gathering extensive details about the fire's origin and spread before dispatching resources is procedurally flawed. This delays the dispatch of critical fire suppression units, potentially allowing the fire to grow unchecked and endanger more lives or property. It violates the principle of prioritizing immediate response to a confirmed emergency. An approach that instructs the caller to attempt to extinguish the fire themselves without assessing the caller's safety or the fire's severity is ethically and procedurally negligent. This could place the caller in immediate danger and is contrary to standard fire dispatch protocols that emphasize occupant safety and evacuation. An approach that prioritizes calming the caller through extended conversation before gathering essential dispatch information is inefficient and potentially dangerous. While empathy is important, the primary responsibility of the etc. in this situation is to facilitate the dispatch of emergency services. Prolonged, non-essential conversation delays the critical information needed for an effective response. Professional reasoning. In situations involving fire emergency, the etc. must employ a decision-making process that follows a clear hierarchy of priorities. 1. Dispatch resources. Obtain the absolute minimum information required to dispatch the appropriate emergency services, e.g., address, nature of the emergency. 2. Ensure caller safety. Provide immediate actionable safety instructions, e.g., evacuate, stay on the line. 3. Gather further details. Collect additional information that will aid responding units once the initial dispatch is complete and the caller's immediate safety is addressed. This structured approach ensures that the most critical actions are taken first, maximizing the chances of a positive outcome. Question 18. Market research demonstrates that public perception of emergency response times can be significantly influenced by the perceived urgency of a caller's situation, even if that situation does not meet the highest priority criteria within established protocols. An emergency telecommunicator receives a call from a citizen reporting a minor traffic obstruction that is causing some inconvenience, but does not immediately present a life-threatening hazard or a significant risk of escalation. However, the caller is highly agitated and insists their situation requires immediate police presence to prevent further disruption. The telecommunicator is aware that a higher priority call for a potential active shooter situation is pending dispatch. Which of the following approaches best aligns with the regulatory framework and guidelines for emergency telecommunicator, etc. certification, specifically concerning prioritization protocols like APCO? Option A. Attempt to de-escalate the caller's agitation by promising immediate dispatch to the traffic obstruction, then re-evaluate the active shooter call's priority based on the caller's continued insistence. Option B. Dispatch a patrol unit to the traffic obstruction immediately to appease the agitated caller and prevent potential public complaints, while simultaneously alerting dispatch to the pending active shooter call. Option C. Follow the established APCO prioritization protocol, which would classify the traffic obstruction as a lower priority incident, and inform the caller that assistance will be dispatched as soon as a unit is available, while ensuring the active shooter call receives immediate dispatch. Option D. Advise the caller that their situation is not a priority and they should wait, then immediately dispatch a unit to the active shooter situation without further consideration of the traffic obstruction. The correct answer is B. Dispatch a patrol unit to the traffic obstruction immediately to appease the agitated caller and prevent potential public complaints, while simultaneously alerting dispatch to the pending active shooter call. Explanation. This scenario presents a common implementation challenge in emergency telecommunications, balancing the immediate need for resource allocation with the established prioritization protocols designed to ensure the most critical incidents receive timely attention. The challenge lies in the subjective nature of potential for escalation and the pressure to act quickly, which can lead to deviations from established protocols. The correct approach represents best professional practice because it strictly adheres to the APCO, Association of Public Safety Communications Officials, prioritization protocols, which are the recognized standard for emergency telecommunicator certification. This approach emphasizes the systematic evaluation of incoming calls based on established criteria, ensuring that resources are dispatched according to the severity and urgency defined by the protocol, rather than immediate perceived urgency or external pressure. This adherence to protocol is a core ethical and regulatory requirement for certified emergency telecommunicators, ensuring consistency, fairness, and optimal public safety outcomes. An incorrect approach that prioritizes a call solely based on the caller's perceived distress or a vague notion of potential for escalation, without following established protocol criteria, fails to meet regulatory and ethical standards. This deviation can lead to misallocation of resources, potentially delaying response to more critical incidents. It also undermines the integrity of the prioritization system, creating an inconsistent and unreliable dispatch process. Furthermore, relying on subjective judgment without protocol guidance can introduce bias and increase the risk of errors, which are unacceptable in emergency services. A professional decision-making process for similar situations should involve a clear understanding and unwavering commitment to the established prioritization protocols. When faced with ambiguity or pressure, telecommunicators must rely on the defined criteria within the protocol. If the protocol does not adequately address a specific situation, the correct procedure is to consult with a supervisor or follow established escalation procedures, rather than improvising a prioritization decision. This ensures that all decisions are grounded in established best practices and regulatory requirements, promoting accountability and effective emergency response. Question 19. Comparative studies suggest that the effectiveness of emergency telecommunicator response is significantly influenced by their ability to rapidly and accurately prioritize incoming incidents. If an emergency telecommunicator receives 3 simultaneous calls, a report of a burglary in progress with a possible weapon involved, a loud argument escalating in a residence with sounds of breaking glass, and a 2-car vehicle collision with no reported injuries, which incident type generally requires the most immediate dispatch of law enforcement resources according to standard U.S. public safety protocols. Option A, a 2-car vehicle collision with no reported injuries. Option B, a loud argument escalating in a residence with sounds of breaking glass. Option C, the order in which the calls were received. Option D, a crime in progress with a possible weapon involved. The correct answer is D, a crime in progress with a possible weapon involved. Explanation. This scenario presents a common challenge for emergency telecommunicators, etc., in prioritizing incoming calls based on the nature of the incident. The core difficulty lies in accurately assessing the immediate threat to life and property when presented with fragmented or emotionally charged information. A domestic dispute, while potentially escalating to violence, may not always present the same immediate, overt threat as a crime in progress with confirmed weapons. Traffic accidents, while requiring prompt response, typically have a lower immediate risk of escalating violence compared to the other two. The correct approach prioritizes the incident that poses the most immediate and severe threat to life. In the context of typical U.S. law enforcement protocols and the general principles of emergency response, a crime in progress, especially one involving potential weapons or active violence, demands the highest priority for dispatch. This aligns with the fundamental ethical and regulatory obligation of public safety agencies to protect life and prevent serious harm. Prompt dispatch of law enforcement to a crime in progress is crucial for intervention, apprehension, and de-escalation. An incorrect approach would be to dispatch based on the order of calls received without a proper risk assessment. This fails to acknowledge the varying levels of urgency and potential harm associated with different incident types. Prioritizing a traffic accident over a confirmed crime in progress, for instance, could lead to a delay in critical law enforcement intervention, potentially resulting in further harm or loss of life. This represents a failure to adhere to established public safety protocols and ethical duties. Similarly, treating a domestic dispute with the same immediate urgency as an active shooter scenario, without further information indicating imminent violence, might overallocate resources unnecessarily, though the potential for escalation means it still warrants significant attention. The failure lies in the lack of nuanced prioritization based on the specific details of the incident. The professional decision-making process for etc. in such situations involves a structured approach. 1. Information gathering. Actively listen to the caller, asking clarifying questions to ascertain the nature of the incident, presence of weapons, immediate danger, and number of individuals involved. 2. Risk assessment. Evaluate the gathered information against established protocols for incident classification and prioritization. This involves understanding the inherent risks associated with different incident types, crimes in progress, domestic disputes, traffic accidents. 3. Prioritization. Assign a priority level based on the risk assessment, ensuring that incidents posing the greatest immediate threat to life and safety receive the highest dispatch priority. 4. Dispatch and information relay. Dispatch appropriate resources based on the priority and relay all pertinent information accurately and concisely to responding units. 5. Ongoing monitoring. Remain engaged with the caller if possible and monitor for updates that may alter the incident's priority or require additional resources. Question 20. The monitoring system demonstrates that a telecommunicator, upon receiving a call reporting a potential animal welfare concern that, while concerning, does not immediately present as a life-threatening emergency, has bypassed the standard protocol for routing such calls to the appropriate animal control agency, and instead transferred it directly to the local police department's dispatch supervisor. Option A. The telecommunicator made a judgment call to escalate the call to a supervisor, believing it warranted immediate higher-level attention, even if it deviated from standard routing. Option B. The telecommunicator prioritized the call based on their personal assessment of potential severity, bypassing standard protocols to ensure a rapid response from a more authoritative agency. Option C. The telecommunicator acted appropriately by adhering to the established call routing and transfer procedures, ensuring the call was directed to the most qualified agency for assessment. Option D. The telecommunicator correctly identified the need for immediate supervisory review due to the unusual nature of the call, ensuring a higher level of oversight before routing. The correct answer is D. The telecommunicator correctly identified the need for immediate supervisory review due to the unusual nature of the call, ensuring a higher level of oversight before routing. Explanation. This scenario presents a professional challenge due to the conflict between established protocol and the perceived urgency of a situation, requiring the telecommunicator to exercise sound judgment within strict regulatory boundaries. The core of the dilemma lies in accurately assessing the nature of the call and determining the appropriate routing without compromising public safety or violating procedural guidelines. The correct approach represents best professional practice because it adheres strictly to the established call routing and transfer procedures mandated by the emergency telecommunicator, etc. certification framework. This ensures that calls are directed to the most appropriate resource, minimizing delays and potential miscommunication. By following the defined protocols, the telecommunicator upholds the integrity of the emergency response system, which is paramount for effective and efficient service delivery. This methodical approach prioritizes accuracy and compliance, which are fundamental ethical and regulatory obligations for an etc. An incorrect approach that bypasses established protocols for perceived urgency fails to acknowledge the potential for misclassification and the downstream consequences of misrouted calls. This could lead to critical resources being diverted from genuine emergencies or vital information not reaching the correct specialized unit. Such an action would represent a regulatory failure by not adhering to mandated procedures and an ethical failure by potentially jeopardizing public safety through an unauthorized deviation from protocol. Another incorrect approach that involves delaying the transfer to seek clarification from a supervisor when the protocol clearly dictates immediate transfer is also professionally unacceptable. This introduces unnecessary delay in a time-sensitive situation, potentially impacting the outcome of the emergency. It demonstrates a lack of confidence in established procedures and can lead to a breakdown in the efficient flow of emergency communications, violating the core principles of prompt and accurate call handling. The professional decision-making process for similar situations should involve a thorough understanding and unwavering adherence to the established call routing and transfer procedures. When faced with ambiguity, the telecommunicator must first consult the established protocols and decision trees. If the protocol is unclear or a situation falls outside defined parameters, the next step should be to follow the designated escalation path for clarification, which typically involves consulting a supervisor or a designated point of contact, rather than making an independent, unauthorized decision or causing undue delay. The priority is always to ensure the call is handled according to the most efficient and effective established procedure.